Sure. So basically, what I think people may not realize about what's known as sequencing is that if a person gets a coronavirus test, all that does is say whether or not they have coronavirus. And it's a whole other scientific process that has to be done in a highly specialized lab to figure out if it's the Delta variant, if it's the Alpha variant, or the various ones that have been circulating. And so that work, actually, we've been really behind. We kind of missed it in 2020. We did not do the kind of sequencing we needed to do, but the UK did. And that's why we called the Alpha variant the UK variant. It's actually, they discovered it, but it could have really originated anywhere. And the reason this type of work is really important is, as we all know now, when you find out something like Delta is more infectious, you may need to take, more dramatic steps to lock down society or figure out whether or not quarantines are appropriate. So that's the base level what you need to do. What I found really surprising was that there isn't really a lot of money for this. So the people who are doing it because they have a scientific interest in it, or they're funded by a philanthropy. There's a few commercial ventures, and the folks who you mentioned, who I went to see in New York, are literally doing it for free. They set the whole thing up for free because they knew that the work was important and critical to our scientific understanding of what was happening with COVID, but it wasn't because the government stepped in and said, hey, let's give you some money to do this.
And the thing about the sequencing is that it has value when you have mass. Like, you have to have a large number, and then you can sort of get an idea of if there are new variants that are emerging, where they're popping up. And one of the things that you sort of say in your article is there wasn't a lot of guidance from the CDC, just from jump, but also the CDC is collecting that data to use it in one way, and that is not the way that, perhaps insurance companies would want it to be used or labs would want it. So there's just like a difference in how they're going about the sequencing because there's a different purpose for collecting the data.
Yeah, the CDC would tell you they have sort of national priorities, and they're sort of looking more at how do we make the next generation of the vaccine so it is the more protective version. And they look at things on a population health basis for the whole of the United States. But the thing about sequencing that I think sort of gets lost here is that it's valuable information for you and I. And I think what a lot of scientists have argued, even highly specialized genomic scientists, have said, give the information to the public. Make a map that's really interactive and quick and easy to read so you or I can make sure our vacation plans are, in keeping with the risk profile we want to have for our families, or things like that, where we're really not given that information as a public. And you mentioned insurers, and that was another really interesting piece that I discovered in my reporting. Insurance is not involved in this at all at this point. So most of, if not all of American healthcare really goes through insurance. There's very little of American healthcare that doesn't go through some form of insurance. But this is all outside of the realm of insurance. And that's actually also probably part of why it's so slow going, because without insurers, you lack that kind of piece of it being part of what's our typical American healthcare system.
Yeah, I thought that was a very interesting cycle in that insurers aren't interested in paying for that sort of data because the treatment doesn't change. Well, if you get sick and you go to the hospital, you're going to get the same drugs. You're going to get, intubated if you need to be, but nothing is going to change about the cost for the insurance companies. So they're not interested. Because they're not interested, then there is no research into how to tackle specifically the Delta variant versus the Alpha variant, so that you can develop treatments that would then allow people to emerge from the virus, healthier. It's this kind of vicious cycle, and it made me wonder if that was part of the reason, if that played a role in why the UK has been leading this for so long, because they have a public healthcare system, so they don't have these private companies also sort of factoring into their pursuit of genetic mutations. Could that be a factor?
Yeah, well, the thing that people say about the NHS, the National Health System in the UK, is that it's also just very connected. So here you might go for a coronavirus virus test at, a CVS or a county health center or your doctor's office or an urgent care. There's just so many places you can go, and so many of those places could just throw your sample in the garbage when they were done with it if they're not interconnected with some sort of lab. And frankly, if a sequencing lab hadn't probably tracked them down to ask them to share the samples with this sequencing lab to do the work. So there's not necessarily our system for testing. It's just kind of all different piecemeal organizations. A lot of private companies have opened up into this space. And so as a result, we just have this fragmented way of testing and getting samples, whereas in the national health system in the UK, it's all very centralized. And so I think the centralized nature made it much easier for the UK to get samples and quickly flex in and out and respond. And you could see at points when they had a bigger outbreak, they were rapidly increasing sequencing in a given part of the country. And that's the kind of thing we need to do too. We need to really double down on, say, places where we have hotspots now, like Missouri, or if we've had a huge outbreak like in Cape Cod recently, we need to make sure we're able to get in and flex up that testing and sequencing capacity really quickly instead of kind of waiting for those results to come back, because we don't have any guarantee that the labs doing the testing are going to hand those samples over to a sequencing facility.
All really great points. As I understand it, things are getting better in the U.S., and the U.S. might be sort of second in the world when it comes to sequencing, but still way behind the U.K. And then there are all the other countries as well in the world that are sort of dragging when it comes to this sort of genetic sequencing. I could talk to you for an hour, Cynthia, but I got to let you go. Thank you so much.
Thank you.